Hello everyone. So in today's video we will be learning about atropine. And atropine is actually an antimuscarinic agent. So what it does is that it blocks the muscarinic receptors present in periphery and central nervous system. So in this way it will oppose the action of acetylcholine. Atropine is actually a tertiary amine and it is extracted from belladonna, which is a plant. So it is a plant alkaloid, belladonna alkaloid, and this alkaloid has high affinity for muscarinic receptors. So if there is presence of a muscarinic receptor, this atropine compete with acetylcholine. So in this way they will compete with each other and one of them will be binded to the receptor. So atropine acts on both central nervous system and peripheral nervous system. In general, actions of atropine last for about 4 hours, but if we talk about eye, its duration of action is much longer than that of systemic absorption. So if we are giving it topically in the eye, its duration of action lasts for many days. If we talk about the affinity of atropine, so affinity of atropine depends upon the neuroeffector organ. Atropine has much more inhibitory effect on the bronchial tissues and sweat and salivary glands, whereas it has less inhibitory effects on other organs. So it has much more sensitivity or affinity for these tissues. If we talk about the actions of atropine in detail, so atropine actually blocks the muscarinic activity going on in the eye. So in this way it will cause the mydrasis. And what mydrasis is? It is the dilation of pupil. And the blockage of muscarinic activity in eyes also result in unresponsiveness to light. And there is cause of cycloplegia, and this is actually inability of the patient to focus for near vision. So these are the 3 things that happen when there is blockage of muscarinic activity by atropine. In this case, one thing should be remembered, that when this muscarinic activity is being blocked, there can be increase in intraocular pressure dangerously in patients having angle closure glaucoma. So in such patients, atropine should not be recommended. So if we talk about the action of atropine on GI tract, atropine as its active isomer, which is called as L-hyoscyamine. So this agent can be used as antispasmodic. So if a patient is having contraction, it can be used as antispasmodic to reduce activity of GI tract. Atropine is one of the most potent kind of antispasmodic drugs which are available today. Another thing is that atropine, as I told you earlier, that it can reduce GI motility by causing antispasmodic effect, but it cannot cause decrease HCl level. It do not cause this. In this way, we cannot give it for the treatment of peptic ulcer. So it is not given for the treatment of peptic ulcer. It is only given as antispasmodic because it is decreasing the motility of GI tract. The dose of atropine which is required for this antispasmodic activity, this dose can also cause decrease in salivary secretion. Not only this, it can also cause decrease in urination and decrease in ocular accommodation. So these effects, when combined, decrease the compliance of atropine. Therefore, it is not much used for the antispasmodic effect. So if we talk about the cardiovascular effects of atropine, atropine can produce various effects depending upon its dosage. At low dosage, what atropine does is that it causes slight decrease in heart rate. But when it is given in higher doses, it causes the increase in heart rate. And why it is so? Because this effect is caused by the blockage of M1 receptors, while this one is caused by blockage of M2 receptors. And how these two differ is that when there is activation of M1 receptors, it causes increase in heart rate. But now atropine is blocking this activity, so heart rate will be decreased. And normally M2 receptor activation causes the decrease in heart rate. But when there is atropine present on the receptor's action side, what will happen? There will be opposite of the normal action. So there will be increase in the heart rate because atropine is antagonizing the effect of acetylcholine. So in this way, the resultant effects are decrease in heart rate when there is low dosage of atropine and increase in heart rate when there is increase in dosage of atropine. And these M2 receptors are being blocked at the site of sinoatrial node, whereas these M1 receptors are being blocked at the site of inhibitory presynaptic neuron. So now if we talk about the secretions which are being affected by the action of atropine, so as I have told you earlier that inhibitory effect of atropine is much more in bronchial tissues, sweat gland and salivary gland. So what happened that there is decrease in the secretion of salivary glands. In this way there is xerostomia, which is dryness of mouth. Sweat and lacrimal glands also have similar activity, that their secretion will be decreased. So when there is decrease in this sweat glands secretion, what happens that the body temperature is being elevated, and it can be very dangerous in children or elderly. So in such patient, this decreased activity of sweat gland can be very dangerous. So it can increase body temperature, because we know body produce sweat to normalize or to cool down the body temperature. When there is no production of sweat, what will happen? The body temperature will automatically be elevated. So if we talk about therapeutic uses of atropine, so first come ophthalmic uses of atropine, mydrasis, which is dilation of pupil, and it is also used to cause cycloplegia. So if both of these or any of these effect is required, atropine can be used. Cycloplegia is actually inability to focus for near vision, so we can use it for either case. But one thing to be remembered, that atropine has largely been replaced with newer agents, because atropine cause ophthalmic action for many days. Like it can cause these two effects for 7 to 14 days. It is a long duration of action. But newer agent only cause these effects for 6 to 24 hours. Therefore, we have replaced atropine with newer agent, because we do not require these effects for such a long period of time. So if we talk about the next therapeutic use of atropine, that is antispasmodic effect. So as I have told you earlier, that atropine can be used to decrease contractions being going on in GI tract. So GI motility can be reduced by giving atropine. Third therapeutic use of atropine is related to cardiovascular system. So it is used to treat bradycardia, slowing down of heart. So if, as I have told you earlier, that in lower doses atropine has effect on heart, that is decreasing the rate of heart. But when it is given in high dosage, it causes increase in heart rate. So we can give it in the conditions such as bradycardia to increase heart rate. So fourth one is related to secretions. So if a patient is undergoing a surgery and we want to decrease his secretion in the upper or lower respiratory tract, so we can give atropine so that it can reduce secretions being released into its respiratory tract. So upper and lower respiratory secretions. Fifth and the most important use of this drug is that atropine is used to treat organophosphate poisoning. If you haven't watched the video related to organophosphate toxicity or overdoses, you have to go to my channel and watch it first, because it is very important topic. And in organophosphate poisoning, what happens, that there is increase in the concentration of cholinergic responses going on in our body. So therefore patient is going through cholinergic crisis. So for that we can use atropine as treatment. Other than this, atropine is also used in the overdosage of such agents like Physostigmine, which is actually anticholinesterase enzyme. In such cases we can also use atropine as antidote, so it can reverse the condition of Physostigmine. Other than this, there is also a poisoning called mushroom poisoning. Such poisoning can also be reversed by atropine, because such mushrooms contain substances that block choline esterase. In this way, there is going on cholinergic crisis. We have to overcome that cholinergic crisis, so we give atropine as antidote. Massive doses of atropine may be required to overcome such poisoning. Atropine has ability to cross CNS, so it can also be used to overcome CNS poisoning or toxic effects. So if we talk about the adverse effects of atropine, atropine can cause dry mouth, as we have discussed that it decreases this body secretions, so it causes dry mouth. It also causes cycloplegia, which can be, in other words, can be called as blurred vision. It also causes tachycardia. As I have told you earlier that increased concentration of atropine can increase the heart rate, so it can cause tachycardia. It can also cause urinary retention. Not only this, it also causes constipation. Again, we have talked about this thing because it is decreasing the GI motility. So what will happen? There will be a resultant effect called as constipation. So if we talk about the CNS effects, restlessness, confusion, delirium, it may also cause depression, collapse of circulatory and respiratory system. In this way, there will be cause of death. And as it causes increase in body temperature because of decrease in sweat gland activity, so it can be very dangerous for children. So if we talk about the antidote for atropine toxicity, we can use low doses of anticholine esterase such as Physostigmine to overcome atropine toxicity. So previously I told you that Physostigmine toxicity can be overcome by atropine. Now I am saying that atropine toxicity can also be overcome by Physostigmine. So it goes both ways, like Physostigmine can overcome the toxicity of atropine and atropine can overcome the toxicity of Physostigmine. Atropine is well absorbed through GI tract and then it is metabolized partly in liver, and after that it is excreted out through urine. If we talk about the systemic intake of atropine, over there half-life of atropine is about 4 hours. But if we talk about topical application of atropine on eye, over there it has much longer half-life than that of systemic, because over there it may cause its effects such as mydrasis and cycloplegia for many days. So this was all about atropine. If you have any question related to the topic, let me know in the comment section below. And thank you for watching my videos.